All right. Good morning. So it's Tuesday, January 30th, 9 a.m. in the State Capitol Conference Room 329. Welcome and thank you for being here, committee members and testifiers, on our first Human Services hearing of 2024, and my first as chair. So the first measure is HB 1974 relating to social services. This is about the needs allowance. And we have testimony in support from the Department of Human Services.
Morning, Chair, Vice Chair, committee members. Lisa Amador, Department of Human Services, Adult Protective Services. We stand on our written testimony in support, offer comments, and are here for questions.
Thank you very much. Next up, we have the State Council on Developmental Disabilities.
Good morning, Chair. Danger Bartolis, Executive Director of Hawaii State Council on Developmental Disabilities. Committee members, thank you so much for hearing this bill. It's been years we've been waiting for it, and we're in strong support, and we stand on our testimony. Thank you so much.
Members, are there any questions? Okay. Thank you. So then next up, we have the Community Home Care Association. No, come on up to the microphone, please. Yeah, that way people can hear you online as well. No, please, just right here. Yeah, and just introduce yourself and then.
Good morning, Chair Lisa and the rest of the committees. Good morning, everyone. My name is Lemmy Mabuti, and I'm the president of the Community Home Care Association of Hawaii. I'm sorry, I'm late, so.
No, you're fine. Proceed. Tell us if you support this bill or not and why.
Yes, I am strongly in support with this bill. I don't know what bill we're talking about now. Is that
we're talking about
HB?
Oh, sorry. The first one is about the needs allowance increasing from $50 to $75 a month.
That's the 1974?
It's, yes, 1974.
Yes, I'm strongly in support.
Okay, thank you very much.
You're welcome.
Members, any questions? Okay, seeing none. Next up, we have AARP Hawaii.
Good morning, Chair, members of the committee. I'm Audrey Suga Nakagawa, Advocacy Director for AARP Hawaii, and we stand in strong support on our testimony. Thank you.
Thank you very much. Any questions, members? No? Is there any, okay, sorry, one question, please come back up.
For AARP, of the two first bills, this one or the next one,
Yes.
which one would you prefer?
Aren't they similar to the care homes? The care home one, this one looks like it's the monthly needs allowance.
Yeah.
And the other one is on the cap, on the state supplemental payments, right? So I'm not quite sure what the difference is, but it sounded like, it's something that we would definitely support. It sounds like it's complementary, if I'm not mistaken. DHS, would you be able to confirm that? Yeah. So we support both.
But isn't this one coming out of personal funds?
The personal funds, I would have to defer that to DHS, how that works about the personal. Is it the question is, does this come out of the personal funds of the individual resident? Is that what you're asking? Are you asking the monthly needs allowance comes out of the personal funds of the individual?
No.
I would have to defer to DHS.
It's, yeah, it's a funding.
I'm sorry.
Yeah, it's okay.
I may be confused, thank you.
Yeah, no. So it's both of those bills are, it's a state match that's required with our agreement with the Social Security Administration, and it is covered within that state match that we are obligated to spend. So part of it is going directly to the residents for their needs allowance, and then the next bill is a state subsidy which augments the Medicaid payments that those caregivers, the operators, receive. DHS, did you want to come and clarify anything further? That's correct. Okay. It is very complicated.
Thank you.
Thank you very much.
Okay.
All right, is there anybody else on Zoom or in person wishing to testify on this measure? If so, please come up. Please come up and state your name.
Good morning, Chair, Vice Chair, and committee members. My name is Kylie Swan. I live with my mom, and I am supporting my advocate who are living in the care home. $50 is not enough to pay monthly income allowance in the care home. Please pass this bill. Thank you. Let me know if you have any questions.
Thank you very much. Any questions, members? No. Is there anybody else wishing to testify? You're all good. Okay.
No, I could testify, actually. I'm on Zoom.
Okay. Please share your name with us and then proceed.
Okay. So I'm Rick Tabor, and I'm a volunteer long-term care ombudsman. So I work with John McDermott, who drew our attention to this, both at the Kapuna caucus and also at Kakua Council. So I agree with I concur with the last person's statement. $50 here in Hawaii is far too little for a person to actually live on. So this actually pays for their personal needs, hygiene products, things like that. So I would strongly encourage us to increase that. And they're only asking to go to $70 at this point. Many states are at $100 actually. So I strongly support the bill as it's written, and thank you for your time. Appreciate it.
Thank you very much. Is there anybody else wishing to testify on Zoom? Okay. Any questions, members? Hearing none, we'll go to our next bill, which is HB 2216. And this one is, rather than targeting the needs allowance of the residents, this increases the state supplement going to the operators of the care homes. And if we could have our first testifier, the Department of Human Services.
Good morning again, Chair, Vice Chair, committee members. Lisa Amador, Department of Human Services. We stand on our written testimony and support, offer comments, here for questions. Thank you.
Thank you very much. Members, are any questions? All right. Then next up, we have AARP Hawaii.
Audrey Suganataka from AARP, and we stand on our testimony in strong support for this increase of the state supplemental payments for our arches and domiciliary homes and the other community-based providers. You know, there are 1,600 of them in our state. They're providing care for over 8,000 residents in the state, and that's twice the number of the nursing home facilities. And so they're a very strong, integral part of our whole continuum of care. So we need to continue to support them. They're cost-effective, they're home-like setting, and they do provide a real important service to our community in helping our residents who are aging or who have some disabilities and need some additional support. So please, we strongly support this bill. They deserve to have the increase in their state supplemental payments. Thank you.
Thank you very much. Any questions, members? Seeing none, we'll move on to United Community Healthcare Hawaii. Karina Ocampo, is she here? Okay. Next we had signed up Lemelin from the Community Home Care Association of Hawaii.
Good morning, Chair, Lisa, Vice Chair, and members of the committee. I just want to read my testimony. But anyway, my name is Lemmy Mabuti, and I'm the president of the Community Home Care Association. I'm strongly in support 2216. On behalf of my Community Home Care Association, 300 plus members, strongly support HB 2216. We provide 24/7 care of a flat rate of $41.06 a day. With the work we provide for the elderly and disabled, truly believe that we are not gone up a single cent for 16 years. Sorry. The skyrocketing cost of providing care to our kupunas and disabled make it nearly impossible to operate. It takes a great deal of commitment, dedication, patience, and love of the job to be able to keep working 24/7 in caring for our clients. It's time for the state of Hawaii to do what's right, support us. we can continue to take care of our elderly and disabled. I humbly ask to all authorities to grant our request. Thank you.
Thank you very much, Lemmy. Any questions, members? Next up, we have from the Coalition of Caregivers, Maribel Tan. Are you here?
Good morning, Chair and Vice Chair and the members of the committee. I'm Maribel Tan, President of the Adult Foster Home Care Association of Hawaii. And on behalf of the Coalition of Caregivers, we submit testimony as a coalition in support to HB 2216. We are the president from 6 organizations representing nearly 90% of the community caregiver industry. We support HB 2216 for the cost of living here in Hawaii have escalated over the years. It's just so difficult for us financially to survive, especially with the cost of housing, food, and commodities here in Hawaii. We save the state of Hawaii significant amount of money for providing care to our kupunas and disabled. It's time for the state of Hawaii to think about us so that we can continue to take care of our vulnerable elderly and disabled. For these reasons provided, we request that you pass HB 2216, and thank you for the opportunity.
Thank you very much.
Thank
Are there any questions for Maribel? Seeing none, is there anybody else in person or on Zoom that wishes to testify on this measure? Please come up, state your name.
Good morning, Chair, Rep. Lisa Martin, Vice Chair, Torres Mato, and members of the committees. I am Karina Ocampo. I am a community care foster family home primary care provider since 2006, and I am currently the president of the United Community Healthcare of Hawaii organization. HB 2216 is the increase in state supplemental payments. I'm in strong support for the increase in the cap on the state supplemental payments for adult residential care homes, licensed developmental disabilities, domiciliary homes, community care, foster family homes. Cost of living in Hawaii is very expensive. All commodities went up during the pandemic and up to the present. So please, again, we humbly request your urgent attention in passing HB 2216 for the sake of our current and future caregivers in the home and community-based programs industry. We are grateful for the opportunity to testify on this matter today. Thank you.
Thank you very much, Karina. Members, any questions? Is there anybody else who would like to testify in person or on Zoom? Seeing none, we're going to move on to our next measure, which is HB 2215, relating to Medicaid. And this is touching on the same care providers, but instead of the state supplement, now we're talking about increasing the rate that would activate actually a corresponding increase in the federal contribution. And first up, we have the Department of Human Services.
Did you call Department of Human Services?
I did.
Okay, sorry, I did. Hard of hearing. I'm Judah Moore Peterson, and on behalf of the Department of Human Services, we stand on our written testimony, offering, appreciating the intent and offering comments. Thank you.
Thank you very much. Members, are there any questions?
I have a question.
Go ahead, Vice Chair.
Good morning, Dr.
Morning.
Peterson. I have a question. In your testimony, I think it was mentioned that this measure could potentially affect the amount of money that DHS is able to draw down from the federal government. How would that work?
I believe we offered the testimony that all Medicaid expenditures receive federal match, and so in any approved Medicaid service, and of which these would be some, get a federal matching rate. and that's there is a set of a federal matching rate that's set by the federal government that each state gets. And so what I believe we were trying to state is that any of the A funds or state funds that would be appropriated would be matched with the appropriate federal matching rate. Is that?
That answers my question.
Okay.
Thank you.
Thank you very much. Any further questions? Seeing none, we'll move on to our next testifier, AARP Hawaii.
Audrey Suga from AARP. We stand on our testimony in strong support of this, and for the same reasons I had expressed in my previous, for the previous bill about the importance of the home and community-based providers in our communities, in our state, and the role that they play. And so we already know that we're facing an acute shortage of healthcare workers, and so we would need to increase the reimbursement so that we can attract, train, and retain these workers who are needed to support our growing elderly population and those who need additional assistance. So thank you very much for the support of this testimony.
Thank you very
for this
much.
bill.
Thank you. Any questions, members? Seeing none, we'll move on to our next testifier, Maribel Tan. Did you want to come up again? From Adult Foster Home Care Association of Hawaii.
Again, Chair, I'm Maribel Tan, President of the Adult Foster Home Care Association of Hawaii. I'm speaking on behalf of the Coalition of Caregivers, and we represent nearly about 90% of the community caregiving industry, which are we humbly request your support to increase the reimbursement rates for CCFFH in the state. Reimbursement for CCFFH and Hawaii have only increased minimally 15 years ago. Meanwhile, we provide 24/7 care, 365 days a year for a flat rate, which calculates to $1.71 per hour. No overtime, no benefits, just $1.71 per hour for 24-hour care. While we have minimal increase in the reimbursement rates, our costs have escalated. It's just so difficult financially, especially with the cost of housing and living here in Hawaii. Even through the worst pandemic in the history, CCFFS maintained high standards with very few cases of COVID transmission and deaths. All this for $1.71 per hour or $1,231.80 per month, which was just increased to $1,324.80 per month, equivalent to $184 per hour starting last January 2023. But with the current inflation rate, it is not enough. We request an increase in accordance to the Milliman study, which was submitted to DHS MedQuest Division last December 30, 2022. It's time for us to show some aloha to our CCFFH, most of whom are immigrants. One thing is for sure, we saved the state of Hawaii a lot of money providing our services at this rate. The system would break down without the CFFH program, which has over 3,500 beds. Private facilities whose main objective is to get private as opposed to Medicaid clients would be unable to handle the additional capacity. It's time for the state of Hawaii to do what's right. Support us so we can continue to take care of the elderly and disabled. On behalf of the presidents and organizations of this coalition, we thank you for the opportunity to provide our testimony in support of HB 2215. Thank you so much.
Thank you. Members, any questions? Next, we have Karina Ocampo from United Community Healthcare of Hawaii.
Good morning once again, Madam Chair, Rep. Lisa Martin, Vice Chair Teres Amato, and members of the committees. I'm Karina Ocampo, a community care foster family home primary care provider since 2006 and currently the president of the United Community Healthcare of Hawaii. On behalf of our caregiver members and our families, we humbly urge this committee to support and pass this measure because it is long overdue. There has not been a viable increase in our healthcare industry in over 20 plus years. Even with a combination of state and federal funds for Medicare and Medicaid in long-term care services, caregivers are underpaid, delayed paid, and many times not paid. Hawaii is a high cost of living state, and as we slowly but quickly come out the past 4 years of COVID-19 pandemic, the inflation of everything for our basic needs have skyrocketed. Before and during the pandemic, as well as presently, caregivers successfully cared for our kupuna through the most stressful plague of our times the whole world over. We continue to keep our elderly and adults with physical and mental challenges healthy and safe. Thus, we deserve to be compensated justifiable in order for our clients and our families to continue to survive. Please, again, we humbly request your urgent attention in passing HB 2215 Medicaid pay increase for the sake of our current and future caregivers in the home and community-based programs industry. We are so grateful to the opportunity to testify on this matter today. Thank you.
Thank you very much, Karina. Any questions, members? Next, we had signed up Roselle Katamping. Is she here? We also had on Zoom signed up Crystal Agaton. Is anybody on Zoom? Okay. Is there anybody else who wishes to testify in person or on Zoom on this measure? Seeing none, we will move on to our next measure, HB 2539, relating to human services. And this appropriates funds to increase the funding for Medicaid in-home services, where people are staying in their own home rather than in a care home. And up first to testify, we have the Department of Human Services.
Good morning, Chair, Vice Chair, members of the committee, Judy Moore-Peterson, Department of Human Services. We stand on our written testimony offering comments. Thank you.
Thank you very much. Any questions, members? Next up, we have the State Council on Developmental Disabilities.
A little bit shorter than Dr. Peterson. Dane Bartolos, Executive Director for the Hawaii State Council on Developmental Disabilities. Good morning, Chair, committee members. We're in strong support of this measure. I'd like to highlight a part of our testimony about setting precedent for aging in place. That's very important to us. Best practices show that an individual, as they get older, if they show signs of dementia, aging in place, staying in the environment that they're familiar with, helps with the anxiety and helps them adjust much easier. So we're in strong support of this, and we really are supporting aging in place. Thank you so much.
Any questions, members? Thank you very much for your testimony. Next, we have AARP.
Audrey Suga Nakagawa from AARP, and we stand our testimony in support, and we concur with the comments that just was expressed by the previous testifier. Thank you.
Any questions, members? Is there anybody else in person or on Zoom that wishes to testify on this measure?
I would, Rick Tabor, if you don't mind.
That would be fine. Go ahead.
Thank you, everybody. I concur with everybody, and I would point out that when surveyed, the majority of people will want to age in place, regardless of the situation. And it's just much healthier for them in the long run. Thank you.
Thank you very much. Is there anyone else wishing to testify? Okay, then we will move on to our next measure, HB 2087, relating to the Executive Office on Aging. This is for a 2-year senior access pilot program to improve access to essential services. And first up, we have the Department of Health. Are they here? No. Okay.
Good morning, Chair Martin, Vice Chair Amato, and members of the committee. My name is Caroline Kadirao. I am with the Executive Office on Aging, an attached agency to the Department of Health. And we appreciate and support the intent of this bill, allowing for a 2-year pilot project at the Executive Office on Aging. We do offer an amendment to this on page 2, line 5, establishing the 2-year Elder Access Pilot Program. We ask that EOA may enter into memorandums of agreement with county and state agencies to implement the project. This allows us flexibility because this is a little bit above and beyond our scope of work, and if this was to move forward, we just would like flexibility with this measure. Thank you for the opportunity to testify. I'm available for questions.
Thank you. Any questions, members? Okay, thank you very much.
Thank you.
Yeah, and I did read that.
Thank you.
Thank you. That is the only person we have that had signed up to testify in person, though there was a lot of written support. Is there anyone else in person or on Zoom that wishes to testify?
Hi again, Kim. This is Rick Tabor.
Okay.
And I really would just say I concur with what Caroline has offered as a amendment and with the suggestion for the bill. Much needed at this time. So thank you for your consideration on this. Appreciate it.
Okay, thank you very much. All right, we are going to move on to our next measure, HB 2224, relating to long-term care. This is again with the Executive Office of Aging, but to create a comprehensive long-term care master plan. And first up, we have, again, from the Executive Office on Aging, Caroline. Please go ahead.
Thank you so much, Caroline Kadirao, Executive Office on Aging. We stand in strong support of this measure. It really is in alignment with our functions as a state unit on aging under the Administration for Community Living and HRS 349. It requires, of course, the master plan and is asking for a 1.0 full-time equivalent long-term care planner in our agency. For some reason, back in 2005, we had a planner, a long-term care planner on our org chart, and for some reason it had been deleted from our org chart, so it has hampered our ability to really coordinate long-term care efforts across the continuum. So this would really help us. And again, as long as it doesn't interfere with the administrative budget, we're in support of this measure. Thank you.
Thank you very much. All right, next up, members, do you have any questions? Seeing none, next up we have AARP Hawaii.
Good morning, Audrey Suga Nakagawa from AARP. We stand our testimony in strong support of this particular measure. You know, back in 2008, AARP played a key role in working and establishing the Long-Term Care Commission, which put together a comprehensive plan or a report to the legislature. And, you know, since then, things have evolved and we're not even sure how much of that particular recommendation was carried out. But so if this master plan is something to complement what was initiated back in 2008, we definitely think it's long overdue. A lot of things have changed. Our HCBS providers industry has expanded, and there's all kinds of new challenges that's facing a long-term care system, especially with the acute workforce shortage. And so we really appreciate having this measure go forward and supporting the Executive Office on Aging and establishing a position so that we can update this master plan and really work on improving our system. Thank you.
Thank you very much. Members, any questions? All right. We next up had on Zoom, Paige Heckathorn Choi. Is Paige here?
Pam, thank you so much, Chair. And I apologize that I can't be there with you all in person. I'm coming down with something and I'm losing my voice, so I didn't think it was appropriate to come in today. But thank you so much for hearing this. I really just want to echo what Caroline and what Audrey said. We only represent, as a healthcare association, one part of the long-term care continuum, and that itself is very complex. There's so much that needs to be coordinated. There's so many different groups that have to come together and set priorities and help us carry out those priorities and work with all of you. So we're very, very grateful for the opportunity to support this measure and just really appreciate your interest in long-term care and supporting the continuum. Thank you.
Thank you very much. So that is everybody who signed up to testify in person or on Zoom. Is there anyone else in person or on Zoom that would like to testify on this measure?
If you don't mind, I would also concur with everybody. This is Rick Tabor. But I would also point out that our Kapuna population soon will be 65 and older, will outnumber 18 and under. And now is the time to really kind of get on top of the services for them. So I think this is a very important bill. Thank you very much. Appreciate it.
Thank you. Members, any questions? Go ahead.
For Ms. Cotterell, please. Thank you for all the work that you've been doing in this area.
Well, thanks.
And I know that you folks have the responsibility for Kapuna Care, Kapuna Caregiver Program, and all of these programs that we've instituted over the last, it feels like 10, 15 years. So I think this is really appropriate. Can you speak to, I know that there's been a lot of groundwork being done in this area by many legislators as well as community members. Can you speak to how this might be intersecting with Dr. Lewin's work with SHIP-D?
Yes, thank you for the question. It will intersect a lot with what he's working on. He's working on really the health care component of it. This is more around long-term care continuum. So in respect to working in conjunction, we will work closely. He has also asked me to sit on one of his task force. I think that's another bill that's being heard, or it has been heard. So again, we'll be working together. This is really looking at that continuum of care in the home and across institutional settings. His is really around payments and ensuring that there's enough support out there for institutional as well as in-home service settings. So that probably isn't the clearest answer, but it works hand in hand.
And then this long-term care planner will be for statewide.
Yes, yes.
Thank you. Thank you, Chair.
Since I'm up here, I forgot to add my amendments that I really wanted to make sure was may I add? I'm so sorry. I realized after I sat down. I just wanted for clarity to add in that Kapuna Care was a demonstration project that was started in '99 and was codified in law in 2012. And then on page 4, line 1, it's important to make sure that it reads 1.0 full-time equivalent, otherwise we won't be able to establish a position. It's a little technical thing, but I've been through that before, and I don't want to have to come back next year and explain that.
Thank you very much.
Thank
we did
you.
see that in your written testimony,
Thank
so
you.
thank you. All right, are there any other questions? Seeing none, we'll move on to our next measure, which is HB 1771, relating to the Hawaii Healthy Aging Partnership, which is a funding bill. And up first, we have Carolyn, again, from the Executive Office of Aging.
Thank you so much. We stand in strong support of this measure. The Healthy Aging Partnership's been in our office and a program we've had since 2006. It's a evidence-based intervention. It's good public health policy. We have 2 evidence-based interventions that we provide: Better Choices, Better Health, which is a 6-week program to help people manage their chronic conditions. Enhanced Fitness is an exercise program that measures before and after results and have scientifically proven results of that. I know that this is asking for funding, and we support this measure as long as it doesn't reduce or replace priorities in the admin budget. Thank you.
Thank you very much. Next up, we have from AARP Hawaii,
Audrey Suganakagawa from AARP, and we stand in strong support of this particular measure. Last year, AARP hosted 2 listening sessions on the islands of Maui and Kauai, and this gives us an opportunity to find out from our community what their issues and concerns were about, what were some of the priorities that they would like to see going forward in the new 2024 legislature. This particular program was mentioned many, many times by those who were in attendance. Many of them have attended the enhanced fitness programs. They really appreciate this low-impact exercise classes, as well as the Better Choice, Better Health Management program. And so we know that that the community is saying that they really would like to see this program continue I was really impressed that during the time of COVID that this program was able to pivot and do and have these online classes. And now that the restrictions have been lifted, having this in-person events really enhances the experience for those who participate in the program. The socialization is very, very important. We know that's important to the well-being of mental health. It reduces isolation, as well as providing them with good exercise opportunities. So thank you very much. We strongly support this measure.
Thank you very much. Is there anyone else in person or on Zoom wishing to testify on this measure?
Well, if you don't mind, Rick Tabor, I'll concur with both folks here. But I'll also point out what Audrey brought up, this isolation. Isolation has actually increased health issues and even death amongst our kapuna. And so being able to get out and do things socially, and we learned so much about that during COVID, is important. And these programs are the most popular amongst our kapuna. So anything to help those move forward would be great. Thank you. Appreciate it.
Thank you. Members, are there any questions for anybody on this measure? Okay, seeing none, we'll move on to our next measure, which is relating to missing persons and establishing a Silver Alert program. I do want to mention that the Department of Law Enforcement was here earlier and had to leave for another hearing, but they wanted to share their strong support for this measure. And we have still here, we have the State Council of Developmental Disabilities.
Good morning, Chair. Committee members, thank you for this opportunity to testify. Dane Bartolos from Hawai'i State Council on Developmental Disabilities. We're in strong support of this measure. We want to stand on our testimony in support. I'd like to highlight a part of our testimony that refers to the Silver Alert Grant Program Act of 2008. By passing this measure, this will help us draw down federal funds to help its implementation. Thank you so much for this opportunity to testify.
Thank you. And next up, we have Executive Office on Aging.
Caroline Kadirao, Executive Office on Aging. We stand in strong support of this measure. We can build, and we defer to the Department of Law Enforcement for implementation. We can build off the Miley Alert program. It makes sense to keep those living at home safely, and our kapuna cared for us, and we should do the same. I want to add a personal story. I know this is my professional testimony. My father has dementia, and he's driven off a few times. Luckily, I have a good, strong support network. We were able to go out and find him. We try hiding the keys. It's difficult. He's pretty savvy. He can find them and find his way out. And it just scares me that if that were to happen and we couldn't find him, having an alert system like this would be very important. And we stand in strong support of this measure. Thank you.
Thank you very much. Next up, we have AARP Hawaii.
Audrey Suga-Nakagawa from ARP, and we also stand in strong support of this particular measure. We are vastly aware of the danger of having people who are with dementia wandering off, and the panic that strikes many families, and when they're losing a loved one like this. I also like to share a personal story myself, because 15 years ago, my uncle who had Alzheimer's was also missing from home, and he ended up the family could not find him, and he lived in Ainahaina, and he was found in Kalakaua. So I don't know how he walked that long distance, and it was just by random that someone was able to spot him and bring him home safely. But should we have had the Silver Alert system in place more aggressively, I think we would have been able to find him a lot sooner. So thank you very much for the opportunity to testify in support of this measure.
Thank you very much. Next up, we have Eric Abe from the Hawaii Primary Care Association.
Good morning, Eric Abe for the Hawaii Primary Care Association. We are in strong support of this and the next measure on this agenda, House Bill 1773. We just wanted to note that our organization worked very closely with the Alzheimer's Association in crafting both of these measures. It is our organization's position that both of these measures will improve the healthcare outcomes of our residents, and I'd be happy to answer any questions.
Thank you very much. Thank you for being here. Next up, we have from the Alzheimer's Association, Ron Shimabuku.
Aloha, good morning, Chair, Vice Chair, members of the committee. We will stand on our testimony in strong support of the measure. If you would indulge me, I would like to acknowledge and thank the primary introducer, Representative Tue Jan, as well as you, Chair, and the committee members for hearing this measure. Thank you.
Thank you very much. Next up, we have on Zoom, Louis Erdeshik from the Hawaii Disability Rights Center. Is Louis here? Okay. Do we have Kylie in person who signed up? Okay.
Good morning, Chair, Vice Chair, and committee members. My name is Kylie. I'm in strong support of this bill because state of Hawaii don't have silver alert for people with disability or elderly individual went missing. It would be great if Hawaii has silver alert in state of Hawaii EAS plan so people can locate the individual and bring them back where they belong safely. Please pass this bill. Thank you. Please let me know if you have any questions.
Thank you very much. Is there anybody else wishing to testify on this measure on Zoom or in person?
I would like to as well, Rick Tabor again. And just to identify myself, I'm a certified developmental disability specialist, and I'm currently vice chair at Responsive Caregivers of Hawaii. I'm not speaking on their behalf. I'm also on FABIA, and I could go on and on and on. I'm a champion with Alzheimer's Association, and I very strongly support this and concur with what everybody said, but like a couple of them, I have a mother that has Alzheimer's, and she has gone missing, and we're very fortunate to be in a small town where everybody knows her, who are helpful. My small town, though, is in North Dakota, and so she actually went out of her house at 3 o'clock in the morning. We don't know what time she went out. She was found at 7 in the morning. It was 25 below wind chill. She lost some fingers. It's very imperative that we have something like the Amber Alert for folks both with cognitive disabilities, but our Alzheimer's community as well. They do tend to wander from time to time, and it's a very dangerous thing. So thank you for your I'm hopeful of your support, and thank you for your time. Appreciate it.
Thank you very much. Is there anyone else wishing to testify? Seeing none. Members, are there any questions for testifiers?
For DD Council. Without this bill, you cannot apply for a grant?
Correct. It's for states that have a silver alert bill law in place.
Is the grant competitive or formula?
I apologize. I'd have to get back to you with that.
And what would be the grant amount?
I know that you could apply for various amounts. It was up to, there was $250,000 the last time I looked up to that amount, but I'd have to get back to you on the specifics. I apologize.
Thank you.
Mm-hmm.
Are there any further questions? Seeing none. Okay, then thank you, testifiers. We're going to move on to our next measure, which is HB 1773 relating to dementia. This one requires the Law Enforcement Standards Board to develop training materials for Alzheimer's, and I did want to mention, because he was here before the hearing from the Department of Law Enforcement, that they actually have a preference for another bill to incorporate these into their into another training program they have, but they do not oppose. They support the intent of this bill. So I just wanted to share that with you, that they had shared with me. And let's move on to the testifiers that are here. First, we have State Council on Developmental Disabilities, Dean Tree.
Thank you. Dean Bartolos, Executive Administrator for the Hawaii State Council on Developmental Disabilities. We are in strong support of training the police officers. Whatever vehicle that goes through, we would support. We've been working very closely with the Alzheimer's Association as well. We have done trainings with the police officers regarding our population of individuals with developmental disabilities. There's a lot of layover. So that's why we teamed up the Alzheimer's to have a joint training which would hit all the points. And again, whichever vehicle that goes through, we'll support as long as the officers get trained statewide. Appreciate it. Thank you so much.
Thank you very much. Next up, we have Carolyn Kairau from the Executive Office on Aging.
It's okay. It's a very difficult name to pronounce. I stand, Caroline Kairau, Executive Office on Aging. I'll stand on our testimony in support of House Bill 1773 and defer to Department of Law Enforcement. Thank you.
Thank you very much. Next up, we have Eric Abe from the Hawaii Primary Care Association.
Eric Abe, Hawaii Primary Care Association, in strong support, and will stand on our written testimony.
Thank you very much. Next up, we have Ron Shimebuku from the Alzheimer's Association.
Ron Shimabuku from the Alzheimer's Association. We too will stand on our written support and strong support. Thank you.
Thank you very much. Next up, we have Audrey Suga Nakagawa from AARP, Hawaii.
Audrey Suga Nakagawa from AARP, and we stand our testimony in support. We would defer to the law enforcement if they would prefer another vehicle to incorporate this particular training. As long as they receive this type of trainings, that would be great with us. So thank you very much.
Thank you very much. Then do we have Angela Melody Young here in person? Please come on up.
Angela Melody Young, testifying in strong support on behalf of CARES. This bill would require law enforcement, such as HPD officers, to be trained to respond to those suffering from dementia. Dementia affects the ability to remember, think, or make decisions that interferes everyday activities. As Honolulu Police Department has to respond to all sorts of situations, officers are the first responders to homelessness. To be culturally sensitive and medically sensitive, officers should be prepared, and it may not be necessary to task the law enforcement standards board with this. Through community outreach, you can find that there are nonprofits and community organizations to help train officers. For example, Crisis Response Intervention Training, a strategy implemented from the Bureau of Justice Assistance, a branch of the Department of Justice at the federal level, is a training program called Crisis Response and Intervention Training for police officers. With the support of the office, the Academic Training Initiative to Inform Police Responses developed the CRIT, a training curriculum designed to prepare officers in the response to those experiencing crises related to behavior, health conditions, and intellectual and developmental disabilities. CRIT is a curriculum that can be customized to local needs and is available online. Hawaii Health Harm Reduction Center did this program in Hawaii with a group of HPD officers. Working with churches and nonprofits gives you the flexibility to work with a diverse group of which already has resources and training programs. However, the church and the nonprofit trainings may need to be licensed, and there could already be a training program from CDC or US Health and Human Services. And if you get that training curriculum to the nonprofits, that could be a possibility instead of mandating the law enforcement board to do this. Thank you.
Thank you very much. We have on Zoom, if Lewis is not with us still yet, yeah? Okay. We have Rick Tabor. Would you like to
I am here. Yes, I would love to. So I stand by my testimony that I also submitted, and I also submitted testimony on the last bill as well. However, I had a technical difficulty, so it came in a day late. It wouldn't allow me to do it on the same day. But let me back up. So the CRIT training that the last speaker spoke about, I worked at Seattle Mental Health for 30 years before we moved home here to Hawaii. And our Seattle Mental Health program actually helped King County develop that very same program for our first responders. So it was much wider net. But we had developed it because there had been some very, very high profile fatalities from interventions that were not managed very well. You may remember there was a Native American gentleman in the middle of the street in Seattle whittling. He was carving something with his knife, and He had an intervention with the officer, and the officer felt threatened by that knife and ended up killing him. He was mentally ill. He was off his medication. But anyway, we use it for mental health, for the training, and for dementia, and for cognitive disabilities. And they're very unique, each one. And I was a part of that training, and the success of it, and frankly, the officers and the first responders were just so relieved to have something like that to help them along. And we would have them go through the training every year. I believe the bill asked for an hour a year. That probably is sufficient. We actually went a little bit longer with folks, and it was just a remarkable program. And so, as the last speaker said, you can easily Google this and look at the information and how successful this program is. Alzheimer's Association has training as well, of course, for folks. And whatever the vehicle, I just think it's really important to pass this bill. And I couldn't imagine anybody not wanting to be trained to work with this population. Each of these populations is very unique. Thank you very much. Appreciate it.
Thank you very much. Is there anyone else wishing to testify in person or on Zoom? Members, are there any questions for our testifiers? Nope. Okay, then we are going to move on to our last measure today, relating to death benefits. So this increases the amount the state will pay for death benefits. And first up, we have the Department of Human Services. Are you still here?
Good morning, Lisa Amador, representing the Department of Human Services. We stand on our written testimony and appreciate the intent of the bill. Thank you.
Thank you very much. Next up on Zoom is Jay Morford here from Hawaii. Okay, Jay, go ahead.
Yes, good morning, Chair and committee members. I appreciate the time this morning. The Hawaii Funeral and Cemetery Association stand in support of this bill. We had long conversations about the reimbursement to the mortuaries when we run into the situation of where we're handling unclaimed. This dollar amount has never been changed throughout the time of everybody that's been in this industry. So it's been decades that it's been $800. Our industry in whole is very supportive of helping the state in these situations. But over the last few years, it's become some liability on our businesses. Some of the families are becoming akamai to how this works, and they're not claiming their family members. They go through the process of unclaimed. We take it, and then they come to us to get the cremated remains after we've done it, after it's been unclaimed. So there is some liability that's attached to us. The costs in general, our overall labor cost, operating costs have gone up over the decades, and I think that this reimbursement being raised will help us offset the cost. Just an example, one of my firms in Honolulu, we just recently had to rent a boat and scattered 110 unclaimed cremated remains. And that's something that we can't just go down to the beach and start scattering that many unclaimed remains. So we would appreciate your consideration on this and moving this bill forward. Thanks so much.
Thank you very much. Is there anybody else wishing to testify on this measure, on Zoom or in person? Seeing none, members, are there any questions? Okay, we are going to take a short recess, after which we'll reconvene for a decision. Okay, we are reconvening the 9 a.m. hearing for Human Services. And our first bill, HB 1974, relating to social services. Chair recommends passing with an HD1, defecting the effective date, and then taking the department's suggestion to delete page 4, line 14 through 17, which says, provided further than that an operator shall maintain records of when an individual authorizes uses from the individual's needs allowance that describes how the money from the needs allowance was spent. This is a bill with no appropriation, and if we are asking the department to do additional services and jobs that they do not currently do, then they will want an appropriation in this bill, and we do want to make sure that it passes so that we can meet our federal obligations with the Social Security Administration. Any questions or concerns, members? Nope. And then Vice Chair, please take the vote.
Voting on HB 1974, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Representative Belatti.
Aye.
Representative Iligan excused. Representative Kobayashi.
Aye.
Representative Takanuchi.
Aye.
Representative Nishimoto is excused. Representative Garcia.
Aye.
Thank you, Chair. Your recommendation is adopted.
Thank you. The next measure, HB 2216, relating to care homes. Chair recommends passing an HD1 just with technical amendments for clarity, consistency, and style. Are there any comments or questions? Seeing none, Vice Chair, please take the vote.
Voting on HB 2216, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members voting, noting the excused absence of Representatives Nishimoto and Iligan, any members voting with reservations? Any members voting no? Thank you, Chair. Your recommendations are adopted.
Thank you very much. Next, we have HB 2215 relating to Medicaid, which increases Medicaid rates for certain community-based care services. Chair recommends amending and passing in the following way: page 3, line 8 and 9, and page 3, line 19 and 20. Delete the phrase "including case management services" from home and community-based case management agencies, and instead insert adult day programs to reflect the priorities of the department. Page 3, line 16, blank out the funding. Page 4, line 3 to 7, delete "provide further that the Department of Human Services shall pursue all funding sources known to the state, including private grants, prior to expending any general revenues appropriated pursuant to this act." It turns out that we actually can't pursue private grants as a match to Medicaid. Defect the effective date, and then include in the committee report the recommended appropriation of $5.75 million, which would generate a corresponding federal match rate in end funds of about $8.14 million. Yeah, and that this is in the governor's budget, supplemental budget at this time. Members, are there any comments or questions? If not, then Vice Chair, please take the vote.
Voting on HB 2215, Chair's recommendation is to pass with amendments, noting the excused absence of Representatives Iligan and Nishimoto. Are there any members voting with reservations? Any members voting no? Thank you, Chair. Your measure is adopted.
Thank you very much. Okay, the next measure, HB 2539, relating to human services, which increases Medicaid rates for in-home care services. Again, I recommend passing with amendments. Page 3, line 8 through 12, delete the same proviso as the previous bill that says that the state will first try to tap into private funding, which it can't do for a Medicaid match. Then also insert into the committee report the recommended appropriation of $9.86 million, which would generate a corresponding federal match rate and end funds of $13.94 million, and affect the effective date. Are there any questions or comments from members? Seeing none, Vice Chair, please take the vote.
Voting on HB 2539, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Representatives Iligan Nishimoto excused for the remainder of the hearing. Any members voting no? Any members with reservations? Seeing none, thank you, Chair. Your measure is adopted.
Thank you very much. Next, we have HB 2087 relating to the Executive Office on Aging. Chair recommends passing with amendments. Page 2, Section 2A, replace the Section 2A with, there is established in the Executive Office on Aging a 2-year Elder Access Pilot Program. EOA may enter into memorandums of agreements with counties and other state agencies to implement this project. The purpose of the project is to improve access to essential services, reduce wait times, and enhance the overall experience for persons 65 years of age or older in Hawaii who are seeking public services through state and county government offices. Page 2, Section 2C, delete lines 18 to 20 and replace with more user-friendly services for kupuna to provide more flexibility. Page 3, line 1, D, please add in, the EOA shall send the auditor relevant information about the pilot program by September 1, 2026 for the purposes of completing an evaluation. That means that what was D before will now become E and affect the effective date. Are there any questions or comments, members? Vice Chair, please take the vote.
Voting on HB 2087, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members with reservations? Any members voting no? Thank you, Chair. Your measure is adopted.
Thank you. The next measure, HB 2224, relating to long-term care. Again, Chair recommends passing with amendments. First of all, there are some technical amendments for clarity, consistency, and style. Then replace page 3, line 21, and page 4, lines 1 and 2, with the following for clarification. However, only one bill was adopted, the Kupuna Care Program, a demonstration project since July 1999, then codified by statute within the Executive Office on Aging in 2012, just to make sure the preamble is accurate. Then on page 4, line 7, replace section 2 with 2, a 1.0 FTE long-term care planner within the Executive Office on Aging to oversee the development and implementation of a long-term care master plan. Page 6, line 4, blank out the appropriation amount and include that appropriation in the committee report and affect the effective date. Members, are there any comments or questions? Vice Chair, please take the vote.
Voting on HB 2224, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members with reservations? Any members voting no? Seeing none, thank you, Chair. Your measure is adopted.
Thank you very much. Next measure, HB 1771, relating to the Hawaii Health Aging Partnership. Chair recommends passing with amendments. Page 5, line 17, blank out the appropriation and then include that appropriation in the committee report and affect the effective date. Members, are any questions or comments? Seeing none, Vice Chair, please take the vote.
Voting on HB 1771, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members with reservations? Any members voting no? Thank you, Chair. Your measure is adopted.
Thank you very much. Next, we have HB 1774, relating to missing persons, the Silver Alert Program. Chair recommends passing with amendments, technical amendments for clarity, consistency, and style. Then page 5, line 12, blank out the appropriation and include that number in the committee report and affect the effective date. Any questions or comments, members? Seeing none, Vice Chair, please take the vote.
Voting on HB 1774, Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members with reservations? Any members voting no? Thank you, Chair. Your measure is adopted.
Thank you very much. Next up, we have HB 1773 relating to dementia. Chair recommends passing with a slight amendment, just to affect the effective date, and include in the committee report that we appreciate the Department of Law Enforcement prefers HB 2250 with the dementia training combined with the crisis intervention training. However, since we don't know the fate of that bill, we'll keep this one moving. Are there any questions or comments? Vice Chair for the vote, please.
Okay, we are voting on HB 1773. Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members voting no? Any members with reservations? Seeing none, thank you, Chair. Your measure is adopted.
Thank you. Our next measure is HB 1533 relating to death benefits. I'd like to, Chair recommends passing with amendments. We'll defect the effective date and note in the committee report that the appropriation required to double the death benefits paid currently would be about $277,600. Are there any questions or comments? Seeing none, Vice Chair, please take the vote.
Voting on our final bill today, HB 1533. Chair's recommendation is to pass with amendments. Chair and Vice Chair both voting aye. Any members voting no? Any members with reservations? Seeing none, thank you, Chair. Your measure is adopted.
Thank you very much. And with that, we are adjourned.